Health workers dealing directly with patients have received a major boost as the COVID-19 Emergency Response Fund began the distribution of personal protective equipment manufactured locally. According to the fund's board, some 237 million shillings has been used in the first phase of manufacturing of the PPEs, with health workers expected to be issued with equipment for the next 18 months to help fight the pandemic. Take a look.
It is at the Kenyatta National Hospital that the COVID-19 Emergency Fund Board made their first stop in support of those in the front line fighting the pandemic.
It's a privilege to welcome you to this occasion today.
The chairperson of the board, Jane Karuku, leading a delegation to deliver consignment comprising of face shields, surgical gowns, nitrile gloves, surgical masks, N95 respirator masks, medical scrubs, among other items, to the management of the facility.
And we try to support all 54 COVID-designated hospitals with PPEs for the next 18 months. So thank you very much. We need your support to use it wisely, and then also call people to give us a fundraise.
Considering increasing reports of depression and anxiety among those on the front line, the board, through the health committee chair, have set aside funds to address the wellness of the workers.
We should be able to support the 50,000 medics in this country with a socio-psycho support or wellness system for 1 year at a cost of 85 million shillings.
The board, which has so far received over 2.7 billion shillings in donations, has assured health workers that the PPEs will be distributed in a coordinated manner, with stringent measures having been put in place to prevent cases of theft and misuse. This will be done by liaison committees formed in all the 47 counties.
They will make sure that the people who need the PPEs are the ones who get it. They are the people who will give us the feedback. They will monitor the levels, and then they'll give the technical committee a feedback on what is needed in that facility for the next round of distribution.
The country's production of PPEs is already at an all-time high, as the board confirmed that equipment worth 100 million shillings had already been ordered by the DRC government. Meanwhile, the United States has granted Kenya 5 billion shillings in aid of the COVID-19 response to finance various programs aimed at alleviating the COVID-19-related challenges. Part of the funds are expected to boost distance learning among school-going children, and some of the money will go towards enhancing citizen involvement in the response to the COVID-19 pandemic.